Hello, and welcome back to another episode of Straight Up with Steph. Do you ever notice yourself just like constantly scrolling on your phone, maybe drinking a little bit more than you meant to, maybe online shopping, and you're not quite sure why you're doing this, but you know that it kind of makes you feel better? Did you know that all of those things are pretty common amongst most of us, but they could be a sign of a mental health condition called ADHD? The more I'm learning about ADHD, I'm realizing how wrong I have been for years about this and how I might actually have it, or at least have tendencies towards it. I have these moments in my life or in my day where I just feel kind of out of control mentally. Like I've got my huge to-do list trying to get all of this stuff done. I'm completely overwhelmed. Maybe I feel like I can't get it all done, or I start procrastinating and just putting things off, which does not help the stress response. But the more I'm learning about ADHD, all of these things are pretty consistent with that. So I don't know. That's a personal thing. I might need to figure that out. But that's what we're talking about today. Historically, I would think of a really hyperactive kid running around the classroom that the teacher just can't get under control and they can't focus on their homework and maybe they get bad grades. That's what I thought of ADHD, but it's so much more than that. A lot of people are getting diagnosed later in life, not as kids, but as adults because of issues they're having just trying to function in daily life. And you'll learn from the conversation today there's nothing wrong, quote unquote, with people who have ADHD. They just have a different type of brain. But because of the way our society is, that type of brain doesn't necessarily fit how our society is set up. And so they really struggle. I wanted to talk about this because I think a lot of dental clinicians have this either diagnosed or undiagnosed. We're perfectionists, we're people pleasers, we have a million things to do at our work, we've got physical pain. There's actually a relationship between ADHD and physical pain as well. So it's like we have all of these boxes that we're checking off. And sometimes we don't know, one, that we have it, and two, how to deal with it. If you're going home at the end of the day after a full day of patients and being completely exhausted and not being able to cook dinner or play with your kids or take your dog for a walk and you just have to crash out on the couch, I mean, sure, maybe it was a rough day at work, but if it's happening day after day after day, maybe there's something else going on. I brought on a guest today who I follow on Instagram. Her name is Jenna, and she is an ADHD therapist and coach. But the way she approaches ADHD is maybe different than what you've heard of traditionally. She has nothing against medication or anything like that, but she really focuses on the stress response. She uses terms like fight or flight, survival mode, dysregulation, and they're all kind of different but also kind of interchangeable. You'll hear it when you listen to her. But her approach is regulating yourself and your stress response and getting yourself just calmed down and not in that survival mode really helps lessen the symptoms of ADHD, or just even if you don't have ADHD, it just helps, right? Because we don't want to be in that constant heightened panic response. And I find myself there a lot, whether I'm seeing patients or I'm at home working, or even if I'm just hanging out at home. It's like sometimes I feel like I just don't know how to relax anymore. I really want you to hear what she's saying because it is so relatable to how a lot of us feel during our day. And she's got some great tips that she shares today as far as what we can do when we're seeing patients, if you're anything like me, I'm working on Mrs. Jones, she's in my chair, but I'm thinking of Mr. Jones out in the waiting room. And I know that I'm going to be 10 minutes late and I know that they're going to be mad at me. And I don't want to disappoint anyone because I'm a people pleaser still. And my thoughts just spiral out of control and I'm not paying attention to what I'm actually doing. It's like I'm kind of on autopilot because I'm thinking about all of these other things. That is a sign of dysregulation. But there's things that we can do in practice right there with the patient that can calm ourselves down physically and mentally, that makes it a much more enjoyable appointment. And then we won't go home at the end of the day being just completely worn out because we've been basically in fight or flight all day long. I think a lot of us can relate to this, whether we have diagnosed ADHD or not. These are some realistic, real tools that we can use during the day. I really hope you enjoy today's episode with Jenna. Hey, it's Steph, and welcome to the Straight Up With Steph podcast, where we have real discussions around health and life and just trying to be better at both. Hi, Jenna. Thank you so much for joining today. I'm so happy to have you.
Hello, thank you.
So I know a little bit about you just because I've been stalking you a little bit online recently. But for those who don't know, can you tell us just a little bit about who you are and what you do?
Sure. My name is Jenna Free. I'm a therapist for ADHD with ADHD. Didn't know I had ADHD until I was 32 and was working with intuitive eating and eating disorders and things before that. But now I'm very passionate about this work and I do take a very unique approach to it. So I always love to talk about it.
I want to get into your approach here in a little bit, which I really appreciate it. But how did you get diagnosed with ADHD?
Mm. Now looking back, hindsight's 2020. I
Yeah.
did always think, wow, it's so funny. Like I think differently than people. I seem to do things differently than people. Oh, I'm just so unique. And just thought that's how I was. And understood that some things were hard for me, but whatever. But then into adulthood, I had two kids, a year and a half apart, and was in grad school, and shit was hitting the fan.
Yeah.
And I said, something's wrong here. Like, I can't sweep the floor. I can't put a load of laundry in. I am so overwhelmed by the tiniest little daily things. Life feels so big and heavy and overwhelming, and I'm frantic all the time. And I knew something was up. And then after a couple years of just Googling things and perusing, I found ADHD as an idea because I had the stereotype in my mind, little boy running around the classroom. And that was never me, especially as a kid. I was the goody goody two shoes, only child, girl. So I'm like, well, that
Perfect.
wasn't me. Yeah, exactly. So far on the other end of like fear and perfectionism and all that. It didn't come to my mind naturally when I was struggling. But then when I got more into it, I thought, oh, okay, I think it's ADHD. And it was a couple years that I'd be telling my mom that, and she's like, no way, until I finally went and got a diagnosis because at the time it was quite expensive. So it took me a while to get going, but then I got it and I got the yes, and I was like, okay, there's some relief even in that, knowing things make a lot more sense now.
I know it's like when you're looking for a diagnosis and you finally get it, whatever it is, it's like it's sometimes depending on what it is, it can be a bummer, but also it's like, well, at least
Mm-hmm.
I know like how to move
Yes.
forward now because when you're just not feeling right,
Right.
So you got diagnosed older. Is that common for people to be diagnosed as an adult?
Women mostly. Some
Why is
men,
that?
but because of, like I mentioned, so the stereotype still, even with medical professionals, is the hyperactivity part, the externally hyperactive, jittery, can't focus, scattered stereotype. Whereas typically in girls, especially because we're socialized to be quiet, to be calm, to be doing things right and perfectionism, it doesn't really inconvenience people as much. So adults are like, oh, my daughter's fine because she's got, we're looking at only the external. Grades are fine, behavior's fine. I'm not bothered by them. So I'm not going to worry about it. But that doesn't mean the girl isn't struggling internally,
Mhm.
right? But we don't know the words for it. So you're just anxious or stressed out all the time and so worried about everything. But that kind of hyperactivity is just internalized, and we mask a lot, better at masking so we can hide it and still do the right thing and behave properly. So as you get older, then I think women start going, but wait, my life's not working for me. This is not fun. And we kind of self-advocate a little bit more and realize this is not quote unquote normal. Something's going on here. And then so not most, but many women need to kind of advocate for themselves.
I work in dentistry as we've talked about,
Mm-hmm.
and a lot of us, I guess I'm speaking about women, but a lot of us, we are very high achievers. We're type A, we're
Yes.
perfectionists, and we kind of joke around with each other like, "Oh, I'm kind of ADD right now." But I'm just like, "Yeah, but are we?" Like for real? Cuz a lot of what I'm learning about now, I don't know, it just kind of checks all the boxes. So it's changing now, but I had that stereotypical image of ADHD as someone who just can't focus and like sucks
Mm-hmm.
at school. But I know
Yeah.
it's a lot more than that. So, what exactly is ADHD?
Well, it's very diverse. There are different subtypes, but kind of I'll just talk about the part that isn't discussed often is that kind of inattentive type, they call it. So it's more forgetfulness, kind of the more subtle, quiet signs, overwhelm, paralysis, distractibility in some ways, but it doesn't mean you're not successful. I have clients who are surgeons, own dental practices, therapists, musicians, and creatives that are very successful. It does not mean lack of success in life. Often we're overachievers, where it's like, I'm getting my self-worth from productivity and achievement because of this kind of struggle inside. It can be so different, but typically the biggest thing I get from adult women who are seeking to get kind of some relief is overwhelm and paralysis are the big ones of like, oh my gosh, I wake up in the morning, I just see everything in front of me. I'm frantic and rushing all the time, and then I crash. So maybe at work, it's like, go, 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 go. Oh my God, I'm trying to catch up, I'm behind. And then you get home, it's like, oh, I can barely make dinner, and you're exhausted. You kind of go in this frantic crash cycle. And then the other piece would be right there for that forgetfulness and that kind of fear of forgetting that kind of can make us overcompensate, where you have lists everywhere and 5 different calendars and you're trying so hard to keep it organized, but we're so afraid that we're overcompensating and it becomes a problem in and of itself. We're not using tools effectively. And it really is, I just imagine like when a car is skidding and we're overcorrecting, overcorrecting this way, then overcorrecting that way. And it feels like such a roller coaster. And that can be a really difficult way to live because you just keep overcorrecting. You never kind of get back into the groove.
Everything you just said, I'm like, oh my God. And actually, yesterday, my boyfriend and I were walking into the store, and I'm like, I think that I might have ADHD. And he's like, you had someone on your, and he knew this interview was coming up, and he was like, you had someone on your podcast about osteoporosis, and then you thought you had osteoporosis. I'm like, well, I kind of do, because I can identify with a lot of what you just said. Can someone have like tendencies towards ADHD, but not technically have it? Or is this something that maybe like ebbs and flows throughout life?
Yes, it can definitely ebb and flow if you have ADHD. ADHD, which, there's no concrete, okay, we've all agreed, we've discovered exactly what ADHD is, how it affects you, and there's a blood test for it. Like, it's not that objective. There's still some nuance around it, but it is a brain difference. Like, there's a chemical brain difference, a physical brain difference. You're born with it and you have it your whole life, and there's no getting rid of it. There's no amount of coaching strategies. Nothing is going to make that go away. But the symptoms and how it's expressed or how you're experiencing it can change over life. So if you have a higher demand of responsibilities, it can just get so much that it's outdoing your coping mechanisms, and now it feels so much harder. And that was me with having 2 kids and in grad school. That's when the responsibilities of life overcame my coping mechanisms and I was falling apart. Okay. But when life was a little less demanding, I was coping well enough, not that it was fun, but I was coping well enough to keep things on the track. Hormones can affect things, perimenopause, PMDD, menopause, obviously all those kind of hormonal fluctuations can also affect symptoms. But when we talk about my approach and how being in survival mode is connected to this, the hormone changes are actually affecting our dysregulation, which affects the ADHD brain. So we'll talk about that in a minute, but it's quite complex, but you can absolutely feel like you're coping okay in one phase of life and then feel like everything's out of control in another phase of life. And that can still be because of the ADHD. There's just other factors that are making it less manageable.
And I notice in my life personally, like my personal life, I would say for the most part, I'm pretty organized and like I know what's going, or no, sorry. See, I just made a mistake. My work life, I feel like I'm pretty organized and I have things like figured out, but then it's almost like I use all of my brain for that. And then when it comes to my personal life, I forget things. I'm walking out the door without stuff. I have to come back and get my wallet that I forgot. It's just like different whether I'm working or just like living my life.
That's very, very common, because when you said that the wrong way first, you're like, my personal life's more organized. I'm like, that's very rare. No, it's always the work I've got on lock, right? 1, it's a little more tangible. 2, there's more external pressure. So when we are not coping well or when we are dysregulated, which I've never met an ADHDer who's not in survival mode or dysregulated. When we are dysregulated, we require the external, almost fear pressure to perform. And when it's your personal life, it's just you, yourself, and you, maybe your family and your partner and everything, but it's not as like, my clients are going to be upset or my business is going to go under. It's a little less intense. So our brain does not have the same motivation and focus when we're dysregulated. That can change. as when there's the external pressure of work, which is what I mostly find is people are like, well, I have this private practice or I'm thriving at my job and I can't cook dinner. I can't put the laundry in. I can't get my kids together. So it's a really interesting difference.
Now, you've mentioned dysregulation and fight or
Mm-hmm.
flight. So maybe just define those. And then
Yeah.
I also want to just know how that connects with ADHD.
So I actually did a poll recently on my Instagram because I do use those three terms somewhat interchangeably: fight or
Okay.
flight, survival mode, and dysregulation, because they all mean the same thing, but they're kind of talking about it from a different angle. And my audience said they recognize survival mode and dysregulation and not as much fight or flight, like identify. So it's all the same thing. It means your body's in a state where you're feeling unsafe. I just got to survive. I just got to get through, right? We just got to get through the day so I can get to bed, so I can go lay down.
Yeah.
We're not really like, hey, I'm cool, calm, and collected, present, living my day, really here for it and experiencing life. It's like, I'm just trying to get life over with, essentially, trying to get the workday over, trying to get dinner over, trying to get the kids to bed. Let's get it over with. That is survival mode, meaning
Hmm.
I am not capable of reaching for anything more than just keeping my head above water. And then dysregulation is the state your body is in when we are in survival mode. And then fight or flight is the ways that the dysregulation shows itself. So, and it's actually fight, flight, freeze, or fawn. This is the four ways that kind of the symptoms that come out when we are dysregulated and in survival mode, because our body and our system thinks I'm in imminent life-threatening danger, right? I need to survive. It's very literal for the body. Maybe not. Your conscious mind knows you're not going to die if you don't get that paperwork in. But our subconscious and our nervous system are living as if I'm getting chased by a bear and I need to be on hypervigilant alert all the time so I don't die. So that is what all of that means. And the ADHD brain tends to tip us into that state. My theory is because we're neurodivergent people living in a neurotypical world. So even when we're young, even if you don't know you have ADHD, we're kind of subconsciously on alert, like, that's not easy for me, or I have to really try hard at that. Everyone else seems to be doing it easy, but I have to do it like that. No, we're supposed to do it that way. Well, my brain tends to do it this way, but okay, I'll force myself to do it that way. And you kind of get into this chronic state of being on alert, being hypervigilant, perfectionism, right? That's why that comes out. Safe nervous systems don't require perfectionism, right? I am
Hmm.
totally fine doing it good enough. But when we are feeling unsafe, the perfectionism, all of that, that is a coping mechanism, a protection mechanism. And it's tricky because it does have its benefits, right? Like you said, in career or having a private practice or anything like that, we are going to quote unquote benefit. It's going to feel like we're benefiting from, look how hard I work. I should have high standards.
Yeah.
No, that's a fear-based response.
Well, it's exhausting too to live like that.
Totally.
Yeah. So I would imagine like this dysregulation or the fight or flight, as that increases, maybe the symptoms with ADHD also increase and then decrease.
Mm.
They kind of go together too.
If you look at like symptoms of dysregulation and symptoms of ADHD, they're almost the same.
Oh, okay.
So it's like we're a double layer. So I have all of these symptoms like distractibility, procrastination, frantic energy, overwhelm, paralysis. I have all that. And then I'm dysregulated, which also has the same symptoms. So now I'm really struggling. So I really say if an ADHD is struggling and you're like, I'm not coping well, you are dysregulated. If you are regulated, even with the ADHD brain, it's really not that bad. Like it's manageable. I have my calendar, I have my watch because I do lose track of time. I have my little tools, but it's child's play compared to when I was ADHD and dysregulated. So it's the combination that has ADHD feel so debilitating and exhausting and unpleasant.
So you take the approach of addressing this dysregulation and not so much like take a pill or take this medication.
Which can go hand in hand, I will
Okay.
say, because for some people, the medication is just a godsend. And I say, good for you. Like,
Like,
do
does
what
it
works for
work?
you.
It's weird to me that a stimulant helps an already stimulated brain.
Yes. And it is odd, but That's kind of how you know you have ADHD. If it's making you high, you might not have ADHD, right?
Okay.
So I'm not a medical doctor and I don't know a ton about how the medication affects the brain, but I know that choosing to go on medication is such a personal choice. I have absolutely no judgment about it any which way, and it's not a moral issue. It is simply, does it work for you or not? And for many people with ADHD, it will not work. I think that's another thing. People think, oh, if ADHD medication doesn't totally change my life and make everything better, I don't have ADHD. No. But it can also be great for some people. So I don't want anyone to feel bad if they're on medication and or wanting to go on medication. Try it. It's also an interesting medication. Talk to your doctor, obviously. But like you can try it for a week, and if you don't like it, just don't take it anymore. Whereas like an SSRI or some other mental health medications are very like serious, and you have to like taper up and then go on it for a long time to see the results and then taper down. ADHD medication is you're kind of taking it for that day's benefit. Yeah, it's going to wear off by like 3 or 4 maybe, which is also a downfall, because then if it's kind of a false up, false energy, and then you might be pushing yourself too hard and you can crash after. So it's a little bit complicated, but it is something you can try. And if you're like, this is not for me, you can change dosage, or you can just decide not to and go kind of more the regulation inner work route. But yes, either way, it's so personal.
So, with this regulation or, just managing regulation, what does that look like for someone? Like, what are some tools that they use?
So I say regulation, and I've been trying to kind of shift my language a little bit, because when I say regulation, people usually think one of two things: emotional regulation or emotional dysregulation. And so people will listen to my content and go, oh my gosh, yes, I totally think emotional dysregulation is my problem. I want to work with you or something. I'm like, I'm not talking about emotional dysregulation, but emotional dysregulation is something that a lot of ADHD coaches and people talk about. But what that is you're in survival mode while having emotions. And yes, when you're in survival mode and you're sad, your reaction is going to be disproportionate. It is not going to be level with the situation you're in. So it's going to feel like the emotions are the problem, but it's the dysregulation while having emotions that are the problem. So that's one clarification that's important, because I never want anyone to think their emotions are the issue.
Yeah.
Emotions are valid. Emotions are good. We don't want to squish them down.
I just need to suppress this. And
yes,
emotions are bad.
Exactly. Yeah. So the emotion's not the problem. And then the other thing people think when I say regulation is nervous system regulation, which is the somatic work, body work, deep breaths, meditation, calming the body. And that is a part of it. But what I really mean by regulation is 3 areas of regulation. And I call this the ADHD reset. So the first is nervous system regulation, which is that body piece. And signs of dysregulation physically would be heart racing, tense muscles, any physical signs of anxiety, stomach in knots and things like that. So we want to observe that physical dysregulation and slow it down. So it might be a deep breath or releasing your shoulders. I know a lot of us can have traps and
dental
jaw
people
issues.
Are like constantly like this. Yeah.
Yes, so tense. So it's like identifying it and then interrupting it and relaxing that. And then physically rushing can also be a sign. And so we're wanting to slow down. Because when you rush, you tell your body, oh my God, there's something to run away from. Oh my God, this is really urgent. Slow it down, physically moving slower. So that would all be nervous system. But if that's all you do, it is not going to be enough to get you out of this state where your whole self thinks you're in imminent life-threatening danger. Okay. We also need to do thought and belief regulation, meaning how is my thinking rooted in fear? How is my thinking rooted in this sensation that I have to be fight or flight, right? I need to be hypervigilant and on the defense because I'm unsafe. And so that can be thoughts like, I'm behind, I need to catch up. There's not enough time in the day. This urgency and panic in our thinking. And the more you get into it, you realize, holy, a lot of what I think is rooted in this fear that I'm unsafe, when that's typically inaccurate. I am assuming everyone is physically safe most of the time. And so we really want to address that, because if we are calming the nervous system, trying to physically slow down, trying to take deep breaths, but then we think, well, I'm behind, I need to catch up. Instantly, you're going to be dysregulated again. Mm-hmm. That's not going to help. So we also want to observe the thinking and then begin shifting it. And then the third is behavior regulation. because the way we function, kind of a ripple effect, when our nervous system is dysregulated, it kind of dictates our thinking. And when our thinking is dysregulated, it dictates how we act or what we do. So that would be things like procrastination, all or nothing. Okay, I'm not even going to start this until I absolutely have to at the last minute. That is dysregulated behavior, right? It's extreme. It's not regulated behavior, is very consistent, a little bit at a time. And dysregulation is that all or nothing. So I can be all or nothing behavior, like I either clean the whole house or I don't touch a thing.
Mm-hmm.
I either, catch up on all my accounting or I'm not even going to log this one receipt. Like
Yeah.
that, all of that is dysregulated behavior. So when you work on all three, that's enough of a change to, you kind of have to wrestle your system out of fight or flight, because that part of us is thinking, I'm in danger, I'm protecting you. So it's good that my heart is racing. It's good that I'm thinking there's not enough time and keeping us urgent and panicked. It's good that we, are acting in this way because I'm keeping us alive. But for most of us, that's not reality. I'm perfectly safe sitting in my office right now. There is no need for me to have any of that going on. And for most of us, most of the time.
It's such a learned behavior, I feel like, because when I look back on, I don't know, just my behavior in my life, I've been like this for most of my life. And I have maybe a small issue. Like I was telling you at the beginning, I've had this internet issue since I moved to this new house. It's actually not that big of a deal. Really, I'm in a beautiful house in a great neighborhood. Everything's fine, but this internet thing has consumed me. And it's my boyfriend's like, can you like chill out? This is not that big of a deal. But it's like I blow it up into this huge thing, and I just think that I'm a failure and nothing's gonna, you know what I mean? It's like I catastrophize, and it doesn't help the anxiety, that's for sure.
Totally. And all of that is dysregulated thinking, right? Because it's like, we don't think like that because our brains are nasty and we're mean to ourselves. We think like that because our brain thinks it's helping us. If I really focus on this problem, I'll solve it and protect myself. Well, unfortunately, our biology has not caught up to modern times where most of our stress is psychological and really not that big of a deal. It's just not matching, because being a fight or flight is useful when you are in imminent life-threatening danger, when there's a bear in the woods, when you are really in danger. We want our system to be triggered into fight or flight, into dysregulation. It's like when a mom lifts a car off a baby, like that's why that happens, is because we're in that. But when you have to clickety clackety work for 8 hours a day, not useful. The blood flow actually leaves our brain when we're in fight or flight. So the prefrontal cortex, a part of our brain responsible for prioritization, planning, logical thinking, has less blood flow. And then we think, why do I have foggy thinking? Why am I doing stuff that makes no sense? We literally are in a physical state to run and fight, not to think and be thoughtful and consistent. So that's why it's so important to get out of dysregulation, because if you want to live in modern society, work full time, and live a more sustainable life, which is most of the time, that rhythm is going to be more successful for people. Like a little bit every day, consistent action, moving forward, trying to enjoy it as much as possible, because this is it, this is life. So I also don't want to just get it over with and rush it by. That energy is going to get you so much further than like, I'm going hard for a week and then I crash for a week, and then I go hard at work and then I crash at home. This like up and down extreme pattern, it does not get really rewarded in our society very well.
No, it doesn't. But you're right. It's a tiring and not a pleasant way to live like this. I just think of dental clinicians. So a lot of us, when we're seeing patients, we're like overstimulated in numerous ways. I mean, we've got noise, we've got people talking. A lot of times we are juggling multiple patients at one time, or we're running behind and we have another patient waiting for us. Like there's a million things. So what are some things that a dental clinician could do when they're in the middle of their day to even notice that they're dysregulated, and also to kind of like bring themselves down?
Totally. So the awareness would be, one, are you present with what's in front of you? If you're working on one patient, thinking about the next patient, that's not the move. So we really want to observe, am I in the room, right? Am I seeing what I'm looking at? And I'm sure you're all doing a great job, even if you're distracted, but that's what regulation is I'm here, present on the step I'm on. And when it's time to go to the next patient, I will then mentally go there. at that time. It's useless for me to be present with this patient, thinking about the next one or worrying about the timing or what are they thinking? Are they annoyed because I'm late? Useless.
That's me to a T.
Yes. It's just going to drain you and exhaust you.
Yeah.
So that would be something good to be aware of. And then what you can do is just kind of come back to the present. Oh, okay. I'll get there when I get there. That's the reality. The reality is you will get to them once you're done here. There's no point. And sometimes it's just identifying how fruitless, opposite of fruitful, all that thinking is.
Yeah.
Right? The anxiety of what are they thinking? Are they going to be mad? Oh my gosh, what time is it? Am I late? The reality is this is going to take as long as it's going to take, and you're going to get there when you're going to get there. And if you can tap into that reality, oh my gosh, the next 10 years of your career, imagine every day having that stress be released. Like, it doesn't take a lot, but it is a lot of repetition, interrupting it again and again and again. And that's kind of the work. So that would be a little bit of thought regulation and a little bit of nervous system regulation right there. Of like, am I tense and like, oh my God, I really got to get to the next person. The nervous system would be relaxing the shoulders, taking a deep breath. And then the thought regulation would be, I'll get there when I get there. Like, because that's the reality. It's kind of releasing that and realizing, okay, my brain's worrying all this to try to protect me, but you know what? I am safe. That's really the root, is you are safe. Even if that patient's annoyed, you're safe. You're okay. And really rooting into that safety is going to make your life so much easier and your workday so much easier. And you're going to get just as much done with way less energy exerted, because we're not wasting so much energy on this stuff that's like doing nothing.
A lot of us too, and myself included, were perfectionists and we're people pleasers. And so there's that,
Yes.
It's like, if I feel like I'm going to inconvenience a patient by 5 or 10 minutes, I feel like I'm falling apart on the inside. So it's like, I got to work on that too.
Totally. And that's the fight, flight, freeze, fawn, right? Fawn. That is like, oh my God, everyone has to be happy or I'm unsafe.
Yeah.
Oh no, everyone's needs before mine, instead of realizing like, hey, it is what it is. I'm always doing my best. I'll get there when I get there. Maybe it's your receptionist communicating extra so that you feel like everyone is understanding that you're a bit late. Maybe it's setting a system up like that for a little bit of external to support yourself, but the real work's the internal, realizing like, and okay, like, what am I going to do about it? Nothing. So why do I want to drain myself in the thinking spiral?
Have you seen like drastic improvements with people? Because I'm at the point, I'm almost 43 and I'm like, this is who I am. I've always been this way. I cannot change. And so this is my life. Am I wrong?
So yes, you are.
Okay.
You are. I have, clients from all ages, like 20s to 60s. And I had someone who's probably closer to 50s or 60s recently, who was just sharing about how like taxes were so draining. They're 3 years behind. Oh my God, it's so draining. Oh my God, oh my God, oh my God. And then through our program, I do group coaching. Through the program, she was like, so I'm caught up on my taxes and I've like cracked the code and I see what the problem was. And it's like, I think I'm going to be good forever with that now. Like, because I'm thinking differently. I'm not in the panic about it, because it's often not the thing that's so overwhelming for us. It's the dysregulation about the thing. So it's not the click, click, clack. That's not very stressful. It's the, oh my God, well, what does this mean? Well, I have to do it right, because if I don't do it right, then I'm going to get fined. And what if I get fined? And oh my gosh, and how many steps is it going to take? How long is this going to take? It's not the like, let me sit down and see what I need to put together. Like, that's not the stressful thing. So we can observe our thinking around tasks as well. And you really can release a lot of it. And I'm my number one client. Yeah. And so I went from like, so overwhelmed, couldn't sweep the floor, couldn't put a load of laundry in. I was not a good mom out the gate in a like stereotypical way of like, I'd forget there's stuff everywhere. Like, oh my gosh, it's so sunny and I forgot hats and I forgot this and I forgot that. And I was just like, definition of like, just keeping my head above water. Yeah. Maybe just my nose above water. Like,
everyone's
so
alive and that's it.
Yeah, like, okay, that's all I can ask. And I truly, my kids are a little bit older. They're 5 and 6, but they're boys and they're wild. But I truly have my feet on the ground. I am present with the task at hand. And I go through the day like, do. Oh, there's some crumbs on the floor. Let me just sweep those up. Do. And I'm like, who is this brain? Who is this person? I still have ADHD. I still see it in some areas, good and frustrating. But like I said before, nothing compared to what I was dealing with before. And it's a lifelong endeavor and a lifelong
Yeah.
skill. I still see when I get dysregulated, and I still have to do my stuff to get out of it and come back down and get back in the groove. But whoop-de-doo, the alternative is get stuck there forever and be miserable.
I don't know. I just feel as we're talking, I'm like, holy shit, I think I need some help. Seriously. Because everything you've said, it's just, I can really resonate with that. Going back to dental clinicians. So I'm a hygienist, but I also help clinicians with ergonomics and posture and things like that.
Cool.
I was curious about the physical aspect of this. Like, is there a physical part of fight or flight or ADHD that could potentially make a dental clinician's pain worse?
Yes,
Okay.
absolutely. I mean, think about the whole day you're worrying about what is that patient thing and what about this and what about that? That's going to create tension. We can have headaches, migraines from being in fight or flight, and being dysregulated. All of that can happen. And then also with ADHDers, I don't know the exact reason, but they're also typically hypermobile, which can create a lot of body pain. So it's like a lot, kind of all the things that come together can create more physical ailments. I would say my tension's definitely gone down since I've been regulated. Mine was more TMJ, like I even got Botox in my masseters to try to make it go away. Trap and like shoulder tension. And yeah, that's still kind of my tense point, but it's not nearly what it used to be where I would be like crying about it. It'd be so bad. So it can absolutely, when you're reducing the stress, when you're out of fight or flight, when your body is in more that rest mode more often, you are going to feel better physically as well.
It's just crazy to me because I used to practice full time and there was a point where I was in pain all the time and I was like
Mm,
doing massage and PT and going to the chiropractor and changing my workouts and doing all this shit. And I was still in pain. And I just am like, I wonder if it was, if this played a part in that. And I bet that's
yeah,
the same with a lot of dental clinicians too.
totally. ADHD or not, regulation work's going to help everybody. It's just that ADHDers struggle more with it because we're kind of, starting with the shorter stick. Like I already have a brain difference that makes these things hard for me. Now add being in survival mode on top of that, and it's hopeless. It's not hopeless, but it can feel that way. But even a neurotypical person who's in survival mode, it probably won't be as detrimental, but it's still not pleasant and still not a nice way to live.
So let's just say if a hygienist is in the operatory and they notice that maybe their thoughts are spiraling out of control or they're not breathing or whatever, is there like a simple, I don't know, tool or checklist they can use that will bring them down just in the moment?
Totally. I do have a free guide people can grab with kind of
Oh,
more explanation, so they can grab
okay.
that. But in the meantime, the physical regulation, I like to keep it so basic. Deep breath, relaxing the muscles, and slowing down. That's
That's
the
it.
biggest physical change, right? So it's like if your shoulders are off your ears, you're holding your breath and you're rushing around, like that's so uncomfortable. And that's signaling to every part of you, like, oh my God, we're in danger. So it's like putting the shoulders down, taking a deep breath, and physically slowing down.
Okay.
Even when I stop talking there like that, my insides go like, it's like quieter. So we want that kind of physical change, and that signals to the nervous system, which signals the brain, which signals our behavior. Hey, the bear's gone. Like you're okay. And yes, you might get all tense and freaking out in a minute or 30 seconds, to be expected, right? That's kind of our status quo. That's our homeostasis at the moment. And we're trying to retrain our system out of that. We're trying to tell our nervous system, our brain, and our behavior that, hey, there's no bear. I am safe. I can relax. But it's going to take a lot of repetition for it to go, oh, okay. So I can just stay down here unless something comes up. And then I get dysregulated, but I do my work to come back down. That is a much kind of healthier, more realistic approach to
Okay.
life, is like you're more typically regulated and then you get dysregulated by some things because life happens, but then you have the awareness and the tools that come back down versus functioning 24/7 from a dysregulated state, and maybe you have a little moment of relief here and there. Like we want to flip it around.
Yeah. Is there something like if they've got these spiraling thoughts, is there something that will just shut that shit down?
Well, I mean, I love a good bit of internal dialogue. So it might just be like, what's in front of me? Like, am I here? Am I in the room?
Okay.
Kind of just questioning, like, am I seeing what's in front of me, right? Am I present with the task at hand? And if not, just kind of letting it go, letting this, kind of like you're on a train track and you're like, you're just going along with the train. It's like, let the train go without you. Stay here in the room. It's safe to let that train of thought go. But when we're in dysregulation, it's like every thought's important. I don't want to forget anything. There's a part of us that's holding on to it. So you kind of got to give yourself permission to stop that train and be here. You are safe to be present. You are safe to be here with this patient. It is safe to be here right now. And that's what we're really trying to train the brain, is like, it's not a dangerous thing to not be like clocking what you're doing later all the time. In fact, your results are going to be so much better in life, and you're going to be so much more enjoyable and so much less exhausted when you can be more present more of the time.
Okay. Man, those are some really good tips. I notice too when I practice, I don't practice as much as I'd like to anymore, but when I do, I've started using ear protection, not like this, but they're just like little things to go in my
Cool.
ears. But in dentistry, we're just prone to like hearing damage because of all the loud noises, but it
Totally.
has brought my anxiety down so
Mm.
much. Like, is that real? Is that something you would recommend?
Yes. Absolutely. So there's like dysregulation and there's overstimulation. So overstimulation is more the physical senses.
Okay.
The sounds, the light, the sights, the touching, all of that, all the senses. And when it's too much, especially the neurodivergent nervous system is like, then we have the big reactions. I get that a lot with touch with my kids. Like they're bumping me or something. I'm like, oh my God, get away from me. This is horrible. But when you're more regulated and you're aware of that, I'm better at just setting boundaries, like, guys, please give me some room, type of things. You're not so reactive. But yeah, very real. So that might be owning what you need a little bit more. Maybe it's weird, but that's part of the journey, is like, hey, I need earplugs, or I need breaks to go to the bathroom with the lights off. I don't know. Maybe just like you need to go in the bathroom, close your eyes for 2 minutes, or quiet for a minute, or I need to step outside in the fresh air for a minute and come back for your break, instead of like, let me hammer out that one more thing on the computer for my break. It's like you might actually be served so much better going out the clinic, having a couple deep breaths in the fresh air and coming back in to kind of reset the nervous system, reset that stimulation a few times throughout the day. But when we're in that hypervigilant dysregulation survival mode, it's like my well-being doesn't matter, how I feel doesn't matter. I just got to get stuff done because I'm behind. And then we burn out because we don't allow for those breaks.
I've discovered the magic of stepping away, like again, back to the freaking internet. It's been a struggle. But I was like, you know what? I just need to go outside for a second. I can't do anything
So
about this.
good.
And then that really helped. But sometimes I forget and I just try to control every little thing and it doesn't really work
Yes.
out.
Totally. And that control, the perfection, all of that is a defense mechanism because we feel unsafe. So I think even that awareness can be so big. Like you go through your whole life just saying, this is just how I am. I'm just a people pleaser. I just am a control freak. No, your system is literally thinking, I will do anything not to die, right? Our survival instincts are very, very strong. And I'm feeling like everything's a danger. So I'm going to really hunker down and like put all my energy into not dying. And the kicker is like, you've been safe the whole time. It's like having a fort and you've like spent all your time building this big wall so the monsters don't get you, but there was never any monsters. It's like you could have been using all that energy to like farm, plant food,
Yeah.
do things to benefit yourself, but all the energy is going to protection to something that isn't there. And that's really what fight or flight is, or dysregulation is I'm trying to protect myself from an idea of a lack of safety as opposed to actual danger.
Where does this come from? Because there's some people that are completely chill, like my boyfriend, totally chill all the time. And I'm just like, and I think, at least for me, I think it started when I was a kid with just,
Mhm.
some stuff that happened in childhood. And it was a survival mechanism that maybe served me back then. It's not helping anymore.
Exactly. So yes, it can be experiences, right? Capital T trauma or lowercase t trauma, right? Putting ourselves in survival mode because we're neurodivergent in a neurotypical world would be like technically trauma, but I don't identify as having trauma in my past. But I was obviously triggered into fight or flight. So it's not always so cut and dry. And then neurodivergence versus being neurotypical. When you're neurotypical and you live a world that's catered to you, yeah, you're going to be more chill. When
Yeah.
you're neurodivergent and things are run in a way where it doesn't work for your brain, you're trying so hard to survive, to keep up, right? So there's all these different things that are happening, which is why we're in survival mode. And then I kind of see it as like once you are in that state long enough, it just becomes your normal.
Yep.
So it's like, it doesn't matter how safe you are now. It doesn't matter how your external world has changed. You got to do the internal work to get back down out of it, because you're kind of almost like stuck on that track, right? It's like the train jumped the track to survival mode. And now it's like, it's not going to just get off because you have a nice home and, you know, you're physically safe. It's only going to get off when we train that train to go to a new track. So that is why it kind of takes that personal effort to get out of it, but it's absolutely possible.
Do you have people that maybe like feel some shame around how they are and they just don't see a way out? Like I would imagine some of your coaching centers around that, right?
Totally. And all the shame, the guilt, that is a protection mechanism. Again,
Hmm.
the brain isn't talking to us like that because it's nasty and horrible. It's talking to us like that because it thinks it's protecting us, right? Because if I feel bad enough, I won't, make that mistake again, and then I won't die, right? So it's like what's using fear, urgency, shame, and guilt as motivators does not work long term. What actually works long term is more desire, want, kind of that pull motivator versus a push motivator. So the fear or the shame and the guilt are just like fear and urgency, right? Like once the bear's on my ass, then I can get moving. If I talk to myself horribly enough and I feel bad enough, then I get going. Okay, but the second that bear's gone and you don't feel like you're in quite so much danger, we crash, right? Whereas if we're using pull motivators of like, wow, I want to do my laundry because I would like clean clothes. I want to sweep the floor because I would like it to be clean. I want to work with my patient because I want to do a good job. Like that is a much more consistent motivator that's going to keep you going in a more sustainable way, but it does not have that intense push of fear, right? Oh shit, I have to do that tonight because it's due tomorrow. Blah, 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 blah. That is the fear, urgency, shame, guilt motivator. And yes, it works very, very short term and intensely. But again, we can see the dysregulation, all or nothing, intense crash versus regulation is more
Hmm.
consistently working towards my goals and taking action, but I'm not going to get in a tizzy about it because it's fine. It's a much more enjoyable way to live, but also more beneficial way to live. And that's why I love regulation work and like the reset and everything I do, because there's no downside. It's not like, wow, I got to slow down and focus less on productivity to be happy. No, you got to get out of fight or flight and you're going to be more productive, less stressed, enjoying life more. Like it's win, win, win. And that's why it's so fun.
I just love talking to you. Yes, I feel like maybe I have an issue that I need help with, but also like you share a lot of hope that like yes, this can get better. I don't know if you put a time limit on helping someone, but like how quickly can someone start to notice benefits after working with you?
Totally. So I have my group program, and I've had people say like the second session, third session, like, oh my God, I'm seeing changes. So it's like you can see glimmers right away, but like to turn your life around is going to take time. I do like a 2 to 3 month programs, but that's not it. It's like, okay, now I've wrapped my head around what I need to practice. Now it's about living in this way, right? Thinking in this way and living in this way. And I do, I have a membership people going after that. That's like just like lower touch, but at least you kind of keep in the conversation, just keep going with the work. And a quote I heard recently that fits so perfectly is anything over zero accumulates. So this is not work you have to dive in and dedicate your whole life to and be obsessed with and thinking about it 24/7 and listening to stuff all the time. It's like, hey, as long as you're doing something to learn about this, to be aware of it, and to make some shifts and prioritize this work, as long as it's not zero, you're headed in the right direction. And that's a nice way to kind of practice our more flexible thinking instead of all or nothing thinking as well. But I would say 6 months, a year, you can look back and go, oh my God, who was that person?
Yeah.
Like that's a big change.
And really, it's funny, when I was younger, a year just seemed like forever. And now it's
Yes.
like that'll go by like that. So,
Yeah. And when we're dysregulated, it can still feel long, right? So when
yeah.
we're dysregulated, we're very zoomed in, focused on this week, today, survival, right? And when we're in survival mode, we don't have much of a horizon. Like I can't really think about next year. I can't really think about 6 months from now because I'm just trying not to die today. So the stereotype is like ADHDers have a shorter time horizon. I can't think about the future. I can't plan long term. Yes, you can. When you're out of survival mode, you have much more ability to focus on next year because you're not focusing on not dying today. So it's like it all such a ripple effect and domino effect with this work. Like how we do this thing affects that thing, affects this thing, and the dysregulation gets its little dirty fingers and everything. So it
Yeah.
really affects how we can do things.
Well, when you're talking about doing like the work and stuff too, even if it takes like a year or 2 years, it's like that time is going to pass regardless. So do you want
Exactly.
to be miserable or do you want to be like trying to get out of this like habit or whatever
Yeah.
ADHD or managing it better, you know?
Yeah, exactly. And, and like I said, it's still a lifelong skill that you then have. Like I was dysregulated last week about some business stuff and and it took me half the day to okay, let's get out of this. Like worrying about this is not making the situation any better. This kind of thinking, being in fight or flight, I could feel it, right? You get so aware of your own body. I can feel that I'm dysregulated. This is very unpleasant and I can see my brain like trying to justify it. And then there's the part of me that's so aware that's like, no, this much worry, this stress, this dysregulation is not going to make that outcome any better. So let's work on coming back down to earth. And then I did, even it was one day that was rough. Whereas historically, I would just stay in that
Yep. For like
forever.
weeks, right?
Yeah. So
Yeah.
it's really nice to have, the awareness. Yes, doesn't mean all discomfort and pain leaves your life. We're not robotic monks when we become regulated, but it's like a blip on the radar as opposed to 24/7.
So I wanted to ask, I know we're getting close on time here, but I wanted to ask if you notice with some of your clients, like habits they do maybe at home that could signal that they're dysregulated. I'm thinking of like constantly scrolling the phone on social media, maybe substance use. I don't know,
Yes.
snapping at your kids or your partner.
Totally. Yeah, and you kind of can put those things into fight, flight, freeze, fawn, right? The ways that being dysregulated comes out. So fight would be that irritability, anger, impatience. Oh my God, come on, let's go. That was me. I was
Yeah.
so impatient for so long, like painfully, like my guts would just be turning if I had to wait for anything. So that would be the fight. Flight would be great avoidance. And that can be through scrolling. It's like, oh, I have something a little bit dysregulating in front of me. Let me go on my phone, which soothes that dysregulation. It does not regulate you, it does not solve the problem. In fact, probably makes it worse in the long run. But
Mhm.
it does feel like relief in the moment. And when we're in survival mode, we're looking for relief and survival. We're not looking for betterment. We're not looking for growth. We're not looking for what's really good for us in the long run. So that's why we go to things that typically we're like, why do I keep doing that? It's hurting me because our system is just like, I don't really care. At least it's keeping us alive today. And then freeze can also be the scrolling. Fawn can be even the people pleasing, right? Can be part of it of like putting everyone's needs, busy work at home instead of relaxing. It's like, why can't I relax? Oh, because I'm dysregulated. But the other kind of more explicit behavior tools could be eating, if you have a difficult relationship with food, like you
Mhm.
said, scrolling, substance use, spending is a big one for ADHDers. And it's just observing. It's not that I have no willpower. It's not that I'm irresponsible or I'm impulsive. It's I'm dysregulated and this makes me feel better. This calms my system down, which is all I'm looking for because I'm just trying to survive the day. And so that's what I love about getting out of survival mode is like, it's probably been like 2 years of slowly going down. I naturally just do not drink anymore. It's just not for me.
Mhm.
I never really was much of a drinker, but I would because everyone else is, and I would always feel bad. But I wasn't able to tap into like, hey, I want to feel good. I want that long term thing. I'm always working on my scrolling. It's designed to be addictive. Um, my relationship with food is so good. I used to be a binge eater. I did more specific work on that, but it's just the same stuff, right? Thinking in a new way, thinking in a more balanced, regulated way instead of out of desperation and fear. So I had to diet and be, a certain size and eat a certain way out of desperation and fear. And that created binge eating. And that was so now I have a very balanced, healthy relationship with food. I want to feel good. I want to eat good to feel good, but that includes, I had fries for lunch today. Like it includes all the nice things. And it's just out of desire. Again, the pull motivators is like, wow, I want to stop drinking because drinking doesn't make me feel good. I want to eat healthy because that feels good. When you're out of survival mode, you think more of the long term and what you actually want instead of just what's going to get me through the day.
I really like that pull versus push thing because I used to do that. Well, I guess in some ways I still do sometimes, but like I don't drink anymore either. And it's like, I did not have a good relationship with that. That's a whole nother thing. But
Hmm.
I kind of do the same thing. Like I want to be healthy. I want to have this healthy life. I want to get good sleep. Like I know how I am when I don't have
Yeah.
bad sleep versus before it's like you have to stop. Like when I was trying to stop drinking, you have to stop,
Yeah.
period. That was so punishing and it didn't feel good. And the
Mhm.
pull method really just, I don't know, it feels better. It's like you're respecting and loving yourself more.
Isn't that cool? And that's what regulation really feels like. It feels like those two differences. It's like, okay, I'm going to function out of fear, shame, and urgency, or I'm going to function out of like, I want good things for myself because it feels good.
Yeah, and I deserve
It's
it.
much more
Like I'm worth it.
sustainable.
So if people want to connect with you, get in touch with you, get coaching from you, where's the best place for that?
But I am on Instagram and TikTok at ADHD with Jenna Free. I have a free guide. Maybe we can put that in the show notes. So
Yes,
that
I
is a
will.
PDF and a little video, just me going through the philosophy and the first steps you can start practicing. And then I also have a podcast called ADHD with Jenna Free.
Okay, awesome. And I've listened to some of those episodes. They're really good. I'll link all of that down in the show notes. And any final words before we say bye?
No, thank you so much. And what whether someone identifies as being neurodivergent or having ADHD, regulation's always going to help. So hopefully everyone got a little something from our talk today.
Totally. Yeah, well, I know I did, and I know my listeners will too. Thank you so much again, Jenna, for your time.
Thank
And thank you,
you.
everyone, for listening. We will see you next time.